Welcome to the 20th episode of our podcast, Career Journeys Real World Insights. With a decade of clinical experience in physiotherapy, today we have a very special guest, Dr. Sandhya Ravi. She specializes in providing telephysio consultations and therapy programs for entrepreneurs, working professionals, and their families. Her focus is on helping individuals overcome chronic pain and mobility issues through evidence based holistic approaches. By leveraging the power of telephysio, she not only facilitates long term recovery but also eliminates the need for unnecessary travel and waiting time associated with traditional in person sessions. That's a great achievement, Sandhya. Dr. Sandhya is not your typical healthcare professional. With a passion for making a meaningful impact on people's lives, she embraces multiple roles as physiotherapist, mentor, trainer, motivator. Her diverse educational background and healthcare education, training, collaborations with various corporates, government, and non government organizations. Driven by relentless pursuit of excellence, she continuously adds value to the individual's personal and professional lives. Without any further delay, let's welcome Dr. Sandhya on our show.
Yeah, thank you so much. That was a wonderful introduction.
We would like to know from you, how come you chose this profession and what made you stick to it?
So during my school days itself, when I studied, we had only very few choices. So one is like a kind of doctor, engineer, teacher, collector. So these were the profession what I have heard from my childhood. But always I was passionate about healthcare. But I was very sure I will not get into MBBS because I'm a person like who don't even take medications. Always like I go with giving my body to heal. I don't know this happened from my childhood. And also my brother also had some health issues. So go having him taking him to hospitals and being back, and there are few conditions which cannot be sorted out with medicines also I have seen. So I was thinking what is an alternative. So physiotherapy was my choice because my parents had different idea in their head, because my dad wants me to do literature because I'm very good in English, so he wants me to pursue in that. But there are a lot of people in my family who are into literature, so I don't want to do that. And my mom loves me to be a nurse, like she wants me to be a nurse. Then I said, no, I don't have that kind of patience. I love healthcare, but the patience for nursing is too high. So I have a patience for physiotherapist, but not to the level of nurse. So I said, I was more interested in neuro. I love studying about a mind, brain, and things. Then in future specialization, that is how we take our graduation, right? So after graduation, what I will do? So in physiotherapy, there were options like you can do masters in orthopedics, neurology, sports, pediatrics, geriatrics, then gynecology. There were so many options were there. So I was particularly interested in neurology. So even in my first year, I studied. No one, it's not necessary for us to study neuroanatomy, but I take neuroanatomy and sit and study that particular book because I'm always fascinated with because a lot to know about brain, right? So always I had this fascination for brain. So that is how I picked. And after completing that time, people are not much aware about physiotherapy. So the admission process was also easier. Right now, it is very difficult to get into this field. But for me, it was a cakewalk during that time, as less awareness about the profession. And during that time, people were not very supportive because engineering was there in the peak. So my relatives and family members were telling like, why you're picking a option where people are not aware, and it is not a growing industry kind of thing, because there are people kind of who already done physiotherapy, we're going and writing government exams and getting into it because of the lack of awareness. But right now, all are proud you have taken a right decision. Because when I started out, it was completely a different. Always it happens, right? When you take something it is not well known in the market, always they doubt our decision. So why did you try this? The same question even I got it. But for me, I was very strong in my decision. No, I said to my dad, if I'm okay, I will study physiotherapy. If not, I'm not planning to do my graduation at all. So that was the strong stand I was. So he said, okay, fine, do it. Whatever you want to do, study.
So you had a lot of
Yeah.
clarity. You were willing to move out of your comfort zone. You were listening to your heart. You had a strong self belief that this I want and this I don't want, and
Yeah.
I can do it.
Yeah, yes, exactly. And when I went and before that, I did some research also. We, even though we were not having much, that time even smartphone was not there. Maybe after second year or third year only, I have seen what is smartphone. Even though at that time it was like not even 2G, 3G time. It was like 1G kind of starting time,
I
like 15
remember
years
those
back.
days. Yeah.
Yeah, 15 years back. But we had, luckily, I was in Coimbatore at that time. I did my 11th and 12th grade there. So we had browsing centers and things. So generally, I'll go and do searches in Google and things like that. So before doing, I had some idea. I went and did my research by doing this, how I'm going to help people and things like that. And there is one silly element to it, why I need healthcare also. Generally, like I'm not that great in physics. Actually, I don't like physics much. I am okay with chemistry and biology. So generally, healthcare there is not much component because compared to engineering,
Yeah.
the physics part is less in healthcare. So that was also one of the reason I want to get into healthcare. But luckily, I'm really unfortunately lucky because there are major subjects for me in related to physics. Because I had biomechanics paper where like how physics works in our body, and I had few electrotherapy papers, something related, everything, the concept. That's what I'm saying, no? Like 30% of the concept what I studied was physics. That's what people tell. What you don't want, you will attract it. Yeah. I took healthcare because I don't want physics. But as I was telling, I don't want physics, I don't want physics, I was attracting physics a lot. But I'm happy still as I could relate and connect at that time. It was better than my 12th physics, 11th and 12th physics. So somehow I managed.
So you were honest to yourself, telling yourself that this is I don't like, and since this is what I like, I want to get into it. Because these days
Yes.
students choose subjects and streams just because they want to please others. But at your
Yeah.
level, you were honest and you took what was right for you according to you.
And yes, that is also one of the reason. And my brother, he wants to get into catering. So he loves to cook. He was very passionate about cooking and things. But actually, he was a complete pure science group. But because of my father's advice, he took bachelor's in computer science, which was completely out of box kind of thing. Even he was not interested. 1 year he went for computer classes and things, but still that was not his choice as he wanted. Always his decision was whatever my dad's suggestion. So even 11th and 12th, science was not his decision. Science was not his cup of tea. It's not that great in science. But my dad did science during his higher education. So during his higher secondary. So he wants a son also to pursue the same. So he took science because my dad asked him to do it. The same thing, even his graduation was the same. And I have seen him, he complains like why he took that because he didn't like the subject. He was not very keen into it. So I was very strong because as he's my elder, I understood what kind of difficulties he have faced. So I
Hmm.
was very strong. No, if I take this as my option, I will take the responsibility, or else there is more chances like I will blame others for the decision. So I don't want to blame. So I was very strong. No, I
So
don't
you
like any
had
other field.
Hmm. So you
Yes,
had a live
exactly.
example in front of you. You took lessons from his decisions and then you
Yeah.
implemented it on yourself. So that's
Yeah, because always, whenever, right, whenever you don't like, you will not put your heart and soul into it.
right,
So
right.
every day there was a complaint from him at home. So even I never blame my dad. I was telling, I'll be talking to my brother only. No one have forced you. No one said if you don't think they are going to kill you. No one said like, dad gave a suggestion. Always you had an option to say no. Why you didn't do that? You could
Right.
have said a stronger no, because
Hmm.
always even for me also, there are times they take a decision, but I'm not a rebellious child. Sometimes, a kind of in between, but I will explain them why I want that. I'll have more clarity, but my brother always goes with the suggestion. So I always tell, even though they suggested, you had your own mind. Why don't you think and you ask them for some more time for you to take a decision? You shouldn't have gone for the admission. Then you always
Right.
tell, no, dad didn't say that to me like that. Dad said, if you take this, you study. If not, no. Then I said, you could have said no. When you say no, I'm not going to study, what option dad has? No other option. You have to say no. Sorry, you have to say yes for the decision what my brother is taking. So even though I had an option to tell, like, yeah, and that time we are not that mature during 15 years. That my brother did like 17 years back, as he's 2 years elder to me, and no one was there to guide us. So
Mm.
mostly, like, he went with the choice of my dad. But as I'm a person who think little more different, so I was very strong in my decision. So always I was very strong in my decision from my childhood. So if I think, and no one can force me to do something. So always, if I take a decision, then I will stick to it. So that is
Right.
how I have been. So it was easy for me, but it was difficult for my brother. So he always want to be in good with books of all. So he will listen, like, for me also he will tell yes. For my dad also he will say yes. For my mom also he will say yes. So I'll say, don't be like that. But that is
That's
how his nature
that's
is.
that's a very beautiful and important lesson you have brought right now in front of us, because most of the students and parents go by what their parents want to do. But the lesson is, listen to your heart. If you feel that you are not in sync with what they are saying, just find out what is best for you and reason it out. Go for
Yeah,
researches, consult counselors, do proper assessments, and find out what your likings are. Thank you for bringing it up, Sandhya. We also want to
yeah.
know
Thank you so
from
much.
you, yeah, when was the first time you came to know of physiotherapy? Because you have been saying that you stay in a place where there is not much awareness about these courses. So was the first time physiotherapy was introduced to you?
Yeah, I didn't search for. I was not much aware about the physiotherapy. There was one of my cousin was talking about it, but I was more interested where I can do my post graduation in neurology. That was my thought process. So whatever I'm studying, I should do my post graduation in neurology. So then I thought, okay, what are the options are there? Then I started searching. And one more thing is, like, I want the white coat. I want doctor in front of me. So these were few things was there in my mind. Okay, what is a profession I can study? Still, people will call. See, whether I can have a doctor in front of me or not, that is a second argument.
Hmm.
But if someone calls you and look up to you as a doctor, so
Hmm.
I want to treat a person. So that was there always. And that too without a medicine, without creating any side effects. What was the option available? So, as you know, at that time, even then, Google was really working great as a search engine. So, when I did that, so during that time, I have heard this term from someone just in a conversation, not much about it. Then later, when I was also searching, I came to know that in this, the course is 4.5 years. I have to do 4 years of my exams, then 6 months of internship. So it is same, like for doctors, they do 4.5 years of their education, then 1 year of internship. And the subject wise also, like, we have to study all the medical subjects, because only if we know medicine, then we can start applying physiotherapy. So then I was very happy that I can study medicine at the same time I can study physiotherapy too. So that excites me. So when I went and saw the syllabus and things like that, then I thought, like, okay, this is the perfect option. This is the right option. We can go for it. And during that time, we had an option to write. We go this educational fair and all, right, after your 12th standard during the vacation.
Yeah.
So that time I went, there was some colleges came for offering physiotherapy too. So that time I've given my name and all. So there was one college, they have sent me a letter for admission, but I didn't join in that college. When I was doing that, before going, my father's friend was an admin in one of the best colleges in Coimbatore. So my dad had a call with him and came to know that they are also offering physiotherapy. And that was very near to my home. It's very easy for travel and things like that. And it's one of the best colleges also in Coimbatore. So then he said, as his friend is there, so he was a little more okay. Then he said, instead of going to that one, you can better pick this college. So I will go and apply for the admission. So then we went with that. That is
Right.
how it happened.
So, Dr. Sandhya,
Yeah.
what are the educational qualifications required for a student who wants to pursue a career in this?
Earlier it was so easy, but right now they are saying it is going to be included in NEET from next year. So I'm not sure how much the processing is happening. And they are planning to increase the year of education too. Right now it is going to convert from 4.5 years to 5 years. So this is the process is happening, but I don't know from when it is going to come. Basically, like for this, you have to complete you should have a your higher secondary education in Max Bio or else pure science. So these are the two options where after if you are a pure science student or if you are a max bio student, then you are eligible for doing it and you have counseling process also. If NEET is not there, if you are having a very good cutoff, you can apply for counseling. So there are websites, there will be application forms comes in, so you can pick colleges from there because the management side right now the cost in fees is really high compared to our days because we get when I studied, that's why I'm saying no, like I'm very lucky. So I got the management seat with the price of government seat money. I didn't pay any donation uh, because at that time the demand was not that high, and I paid the same counseling fees what the people come through counseling. The same fees was for the management quota too. So I joined in management, but still at the pricing of government fees. I didn't pay anything extra. But right now, the industry is different because the demand is very high. Yeah. So the management cost, you have to pay donation, you have to pay your fee structure has also got increased. But if you're getting a really good score, you're going to spend less money. Hardly like for 4 years, completing the overall internship, you will be spending, according to me, I think it's around 1 to 1.5 lakhs if you go through counseling and if you get selected in a good college. So that is how the cost is going to be. But the same thing if you're going through management, at somewhere from 10 to 20 plus L. So it changes. And it changes from place to place, college to college, university to university.
Right. So students can just Google and find out what are the colleges available and how is the admission process in their locality or even for the top colleges, as
Yeah,
well
yeah.
as
Top
the
college.
fees. Hmm.
Yeah, as well as the fees they can think, and most probably in the top colleges also if the students are really getting a good score, uh, automatically they can easily get into counseling because when I studied I was not aware there was a counseling option. That is the reason I went in management because when you go in a counseling and when you are eligible, example if you're an OBC, if you're an SC and things like that, you get scholarship also. So my friend, she got extra pocket money from the scholarship than the fees.
Good one.
The thing is like a scholarship was higher than the fees what she was paying, so
Hmm.
she will take money extra home. So that is how the scholarship was there during that time. I think so still that option will be available if they are going through counseling. Even if I have gone through counseling, I had an option for scholarship, but I was not aware there is something called counseling. And the fees was also it was affordable for us to pay, so I just went through management seat. That's what I'm saying. No, at the time no one was there to guide. I'm the
Right.
first one in my family doing physiotherapy, and no one had idea like what needs to be done, how to go forward, and things like that.
When you are studying physiotherapy in college for 4.5 years, do we study very deep just like a medical student, or is it comparatively lesser? Can a student who is not very studious afford to study this subject?
It is very, very studious. It is very deep. Physiotherapists study more deep than the medical student. And there are few subjects we don't study what is there in the medical because we don't study much into medicines and things, but we study medicines, but not very deep into the composition and things like that. But the very core subjects for both medicine and physiotherapy are equally similar, and we study much more deeper because most of the time the cases comes to us with a medical example. If we are handling a patient with a total knee replacement, okay, so we have to know complete about the knee joint. We have to know what is exactly the procedure of total knee replacement, and we have to know what kind of medications they are taking, what is the indications, what is the contraindication, the age factor. We have to know in and out before we are starting our therapy. So for us it is more deeper than the thing. So generally, like I worked as a tutor for some time in a college. So it's a medical college. So there is a physiotherapy department too. Sometimes the uh, professors in medical college tells that uh, It's very difficult for physiotherapists than the MBBS students. That is how the subjects are. But when you start, see, or if you love healthcare, if you start reading, you will fall in love with the subjects. That will, like when you're studying deep about you, it's more about studying about you, right? It's your body, your joints, your bones, your muscles. So once you're knowing like how the systems are working, so it'll make you more excited. So it depends from person to person. Like I love reading each and every book. I can study for hours and more. So that is how it is.
Great. So students have to go deep and understand their own body so that they can help others in these movements.
Yeah.
What is physiotherapy and what is the difference between physiotherapy and telephysiotherapy?
Yeah. Fine, got it. I understood from what I'm doing. So physiotherapy and telephysiotherapy both are same, but only the method what we are using, the channel what we are using is different. Uh, Generally, people think I will give my perspective. The definition of physiotherapy is equally the same of the definition of health. So helping a person physically, mentally, emotionally, and socially. So these are the four aspects we have to help a person. So we are not helping them to get rid of a problem. Actually, we are handling with a human. So the human is not just a body. So he has mind, he has emotions, he has social as well. So that is his environment, the relationship, everything plays an important role. So that is why during our education, we study psychology and sociology as well as a part of our curriculum. So we have to understand the mind, not just the mind of the patients, because it is a kind of like a broad spectrum, right? When a patient is getting admitted for an injury or an accident or for any kind of problem, it is not that person alone. The whole family members are getting affected. So we have to know the psychological level of the individual and also the family and also the social scenario. So this is how it is. We have to think in a broad aspect than just treating the pain. Actually, this is the real definition of physiotherapy, actually.
Hmm.
So example, mostly nowadays, according to me, what is happening in the industry is, and people what they are aware about physiotherapy is, physiotherapy will treat to reduce the pain. If I have a joint pain, if I have a back pain, if I have a neck pain, then I can go to a physiotherapist. They will help me to reduce the pain. But generally, that is not true. So that is also a part of physiotherapy. But on day one, when you are having a pain, example, Sakshi there. Sashi, as soon you get a pain, what will be your first source to get rid of it? Where
A
will you
pain.
go? Yeah, the
I'll,
pain. How will you get rid of the pain?
yeah, I would like to visit a doctor.
Before visiting the doctor, what will you do?
I'll try some home remedies.
Yeah, you will try like a move or Volini or something
Yeah,
like that. You will apply a
yeah,
pain gel or something.
right,
You will
right.
see if it don't work, then
Hmm.
also you will not go to a doctor. Do you know what will be the next place you go? In India, I'm talking about the scenario of India.
If I have a pain, I'll either, as you said, like I'll try my own tricks, or I'll ask someone elder in the family, how can I help
Mm,
it? Someone who has
yeah,
already undergone this. So then they will suggest something what to do.
yeah. So if not home remedies, okay, I'll give you the next point. We directly go to a medical shop and we will ask, I'm having a back pain. Can you give me a painkiller? So I'm talking about the Indian scenario. Okay.
Hmm.
So they go to the medical shop and they will get a painkiller or whatever. See, you go to Indian medical shops, like whatever, even though not to be given, still you will get the medicine.
OTC medicines are available.
Yeah. So
Yeah.
you will get they will give a paracetamol or they will give something according
Hmm.
to the complaints what you tell to the medical shop person, the
Hmm.
pharmacist. So still it don't works. Then if that also don't work, then you approach a doctor.
I
Yeah.
remembered now.
Yeah. You approach a doctor. So once you approach a doctor, doctor may tell for a injection or something like that. As soon you have given, if it is done, you will not bother about anything. You'll feel good and that's it. Okay.
Hmm.
So generally, when a person come to a physiotherapist, very normal case, there are a few peculiar cases. They come directly to the physiotherapist after the surgery and post-op. Doctor directly they will suggest to the physiotherapist, but most of the time they will come to a therapist at a very later stage. In that stage, actually the problem is not pain. They have been with the pain for quite long time. So the problem is there are things which is affecting their day to functions. What they are feeling is pain, but they don't come to relieve their pain. This pain is really affecting their day to day activities. Example, it is affecting their sleep, it is affecting their walking, or it is affecting their work, it is affecting their day to day activities. It is difficult for them to comb their hair, or dress up, or drive a four-wheeler or two-wheeler. So the functions of their day to day is getting affected. So we physiotherapists will help a patient to improve their functions. Okay, we work on pain also. We don't say no. It depends upon how much is their pain level. Accordingly, like we work. Other than that, more than pain, improving the functions, automatically there will be a bonus of pain relief. Example, now Sakshi is coming to me as a client. Okay,
Yeah.
and you're telling Sandhya, I'm having difficulty in walking. Then I'll ask you like how long you can walk in a day. Then you say like earlier I used to walk for an hour, I didn't have any problem. But nowadays even like 5 minutes of walking is giving me pain. So I can't go beyond 5 minutes. Then slowly with the process, okay, then I say, okay, if I help you in a week to go from 5 minutes to 15 minutes, will you be happy? You say, yes, okay, we'll go on. So if I'm improving from 5 minutes to 15 minutes, then automatically 15 minutes, then automatically there is 10 minutes of improvement in your functions. And the 10 minutes of improvement functions, and 10 minutes the pain relief also would have been done. So right now, after 15 minutes only, you'll have the pain.
Okay, it's
So the thing
mentally
is,
fixed now.
yeah. So the thing is, when your functions are improving, automatically the
Hmm.
pain relief will happen. So pain relief is a bonus. Pain relief is not the first concern. And very important thing is, pain is actually a good thing. Generally, I will advise all my patients. Be happy that you are having pain. That means your sensations are working. There are so many people, their sensations are not working. They can't feel the pain.
The body is talking.
Yeah, the body is talking. That means you're having pain. So that means it is telling you that there is something. So go and ask for a help.
Hmm.
So once you
Right.
ask for the help, automatically it goes. So in our life, pain is inevitable, but suffering is evitable. So we don't need to be worried about pain. First, we have to know the difference between pain and body. So pain and suffering. So as you asked the question, what is physiotherapy and what is telephysiotherapy? So physiotherapy is like in clinic. So we have different modalities, and there are so many factors when you give physiotherapy because you, as I said, you ask, is it very deep? Actually, if you want to be as successful and best, you have to go really deep in physiotherapy. If you're really deep in physiotherapy, always you'll be the best among your peers. If you just study for the sake of degree, you will have a degree of physiotherapy, but I cannot guarantee that you can be the best in the industry. So it is always a lifelong learning process. After your graduation, it is not your education ends. After that, only
It
once you
starts.
start seeing your patients, yeah,
Yeah, it
every day is
starts.
learning.
Yeah.
Exactly.
Since the
Every patient is
lifestyle
a
is
learning.
change, yeah. Since the lifestyle is changing, more people are using internet, sitting on the tables, desk, and using laptops. So this issues of visiting and having pains and then consulting a physiotherapist, I feel the demand will be increasing in the future.
Yeah, exactly. For already it is demanding. Already it is a booming
Hmm.
industry.
Hmm.
Right now in future, like recently I studied the statistics, but I don't know exactly the number, but it is somewhere in billions. We are also playing a part in that. So it is really right now kind of like you say like this industry called sunset and sunrise industry kind of thing. Right now physiotherapy is in a phase of sunrise industry. So other professions,
Hmm.
there are so many professions which were booming earlier. Right now, it is getting into the phase of sunset.
Right.
Yeah, sunset in the sense people are using only for emergency. Actually, physiotherapy is a part of prevention. It is more on preventive medicine. And right now, people are also looking for prevention than curative.
Yeah.
Earlier, they were giving more importance only when they get a problem, they want to get it solved. But right now, people are giving more focus on they don't want to get into the problem in the first place.
Yeah, so people start approaching physiotherapists the moment they identify rather than going to the counters, as you said earlier.
Not only before identifying, example, you want to be fit,
Hmm.
but you have never tried any fitness. And if you're going to a fitness center and you want to do some routine and things like that, you don't know how much your body is ready. So before starting their fitness, if they come to a therapist for 1 week or 10 days, they will help you
Mm.
to set your body ready. So even after going to do your fitness, even if you do something wrong, still it will prevent you from injury because
That's
your
something new I came to know today.
yeah, your foundation is set because most of the time they go fitness, they
Mm.
create an injury and they come to physiotherapist. So always I suggest people, you come to physiotherapist. So after going into your fitness routine also, you will not get into injury. So can just proceed on your fitness journey than creating an injury and coming back and quitting the fitness. So the perspective and the thought process is different.
Right. With this, is physiotherapy limited to few sectors, or it's like across all the sectors we can spread it? Because we have also heard of sports physiotherapist and
Yeah.
then others. So, what are the different branches where a student can explore and work in?
Yeah, so there are a lot of branches where you can explore. And before continuing with us, I haven't completed your first question, that is telephysiotherapy. So, telephysiotherapy is nothing but I do consultation online completely, like on a Zoom call, understanding patients. Because in telephysiotherapy, it's not like for all the conditions you can proceed with the telephysiotherapy. There are few conditions they need an offline where they have to go to the clinic and take some sessions. But there are most of the conditions which can be handled in online. So as I said, if a chronic conditions, if a patient is already having a problem for 2 years, 3 years, they have tried everything. So when that comes, the problem is more on function. So it is easy to handle in online. And for people, work related injuries like ergonomics, and there are a lot of preventive approaches in physiotherapy, those all can be handled in online. So where we can guide, and it is very completely personalized and one to one. It can be done in online. That is digitally, we can help a patient to solve the problem, cutting down their transportations, waiting time, and it's more helpful for the people who are into busy professionals or who are not having much access to a offline physiotherapy because of the distance, because of their location. Because right now, even in a rural location, internet facilities are available, but there may not be a physiotherapy center. But they need
Right.
a best physiotherapist consultation. So in
Mm.
that case, a person from Odisha can connect with me if they are having an internet connection. Still, they
Mm.
can approach me for the consultation and therapy purpose. Yeah, so that is how the demand is growing. Because generally, when it comes to medical, always people wants to go to an expert or an experienced person. But in your locality or location, you don't find an expert or experienced person. So as the telephysiotherapy option is there, it's very easy for you to approach in online.
Right.
Yeah, and
Thank
got it.
So that is telephysiotherapy and physiotherapy, people approaching across borders, boundaries in online
Yeah.
platform.
In online platform. Physiotherapy is overall same, not much difference, and it is having a different branches and things where people therapists help you in a different form or different methods. But the medium of using, one is the clinical setup, one is an hospital setup, one is an online. So
Mm.
that is a growing one in the future.
Right. So
Yeah.
those who take up this work as a profession, they can work as a freelancer, maybe government organizations, non-government organizations, hospitals. Yeah.
Yeah,
So
they can work a lot, but generally, generally in our profession, we don't like to call it as a freelancer because we are handling with a human. So, even though people go and do it as a home therapy, going and looking at home as a physiotherapist, visiting the patient's home and doing, they are into practice only. They are not because generally freelancing means they will do sometimes, they will not do. It depends upon their convenience. So instead of we can say freelancing, like people do home physiotherapy.
home
Yeah,
physiotherapy, then we have people working at government places,
yeah,
hospitals, then clinics, and then private clinics.
yeah. Running their
What are
own
the
clinic.
Yeah. What are the different sectors across which they can work? Just like one we were discussing earlier was sports physiotherapy.
Generally, as soon you completed your graduation, you are eligible to work in any sector because in your 4.5 years of education, most of the sectors are covered because you study orthopedics, you study cardio, you study neurology. You study most of the sectors, whatever we read, we study as a when you want to get into the depth, you'll be doing your post graduation. And if you're already into clinical practice and things, there also you will gain a lot of experience. In post graduation, what are the options available as a specialization? It's like they have an option for orthopedics. That means like any injury, fracture, or surgery cases like total knee replacement, sciatica cases. There are a lot of cases, cervical spondylitis. Everything can be seen in orthopedics as well. And you have neurology, where mostly even a UG person completed graduation can see these cases also. But generally, now people look for specialization. So, in that aspect, in neurological, mostly they will handle cases like pediatric cases like cerebral palsy, Down syndrome, then stroke, Parkinsonism disease, Alzheimer's. There are a lot more areas. Sciatica also a kind of. It can be seen both by an orthopedic specialist or can be done or with an experience. So there are so many options. What kind of patient they'll be seeing. And you see, like in sports, for all the sports related injuries, you can work. Even one of my junior is there right now. He has been sports therapist for U17 and U19 for India in the world level. So as a therapist for the Indian team, U17 and U19. And there is one more person, like he is also for the Indian team in swimming. There are people in cricket. There are people in hockey. There are
So
therapists. And you would have seen
specific
recently the
games.
World Cup
Yeah.
matches.
Hmm. Yeah.
Yeah, they'll be learning all over sport. Then once you get into a particular field, you will get expertise in that. That happens during your working phase.
So
You
there
can
are
work in any sports.
opportunities.
That option is there.
Yeah. So multiple
Lot of
opportunities and
opportunities. In sports, there are
specializations.
n number of opportunities. Yeah, and you
So,
have pediatrics, you have
hmm,
geriatrics, yeah, and you have cardiorespiratory. During the corona, the more needed physiotherapy option was cardiorespiratory because of the breathing issues.
hmm,
Uh, there are heart related issues, respiratory, lot of things. So there, the cardiorespiratory physiotherapy plays a major role. They mostly work in ICUs and at different areas where respiratory and cardio need and demand is there.
right. So does the educational journey which you get in the college during graduates and postgraduates, it's sufficient or you need to keep on updating or learning something new in terms of
Hmm,
getting skilled? Yeah.
there are so many skills which are available, but according to me, the education what we're getting in the graduation is more than enough. And more important is like I want to give a small suggestion or advice from my end for the people who are completing their 12th standard and getting into any profession, any career, what they want to do. It's like till 12th standard. So the whole family is telling you complete your 12th standard, you can be free, you can enjoy your college and things like that. But the thing is, your first year is very, very important and it is a foundation and it is core. And that too for physiotherapy, if you give your first year loose, then you're going to suffer for rest of the years. If you are very good in the subjects of your first year, the rest of the years will be like a cakewalk because this is the foundation and this is the basic and it is little more deeper than any other years. So if you concentrate on these things, rest of the years you will shine like a diamond. But if you don't do here, because why this is happening is because I see people around me complete your 12th standard, score good marks. So you don't need to worry about your college. You can go and enjoy college. No. Once you enter college, education in school is different and education in college is different. In school, they will spoon feed you. In college, they won't do that. You have to go and refer. You have to go and get the materials. You have to do a lot of things. Because I see a lot of young generation, they say that, ma'am, there is no teaching in the college. When I studied as a, sorry, when I worked as a tutor, there was one of the student's parent approached me and said, ma'am, is it possible for you to take tuition for my son for
Yeah.
physiotherapy? But actually, the college where I worked, they get taught twice because one, as is a medical college, the first year subjects are all kind of first year, second year, more of medical subjects. So there will be a tutor from medical college comes and teach them.
Hmm,
Example, in first year there is anatomy, there will be anatomist will come and teach them. And there will be
hmm.
one more faculty in physiotherapy also will teach them once again. But even though we teach, still they have to put a lot of mind into it to study, as it is a little more deeper.
Right. So a lot of
Yeah.
self-study is required, and they need to put
Self-study.
in their heart so that they can understand the depth of the
Yeah,
topics.
exactly. And as you know, science, you have a lot of terminologies. Like you have
Right.
to learn all, it's very difficult to get into your lips
Mm,
to tell those things.
mm,
Example, that is one muscle near their neck. The name of the muscle is sternocleidomastoid. Okay, this is the name. Okay. Actually, like when you understand, it is very easy. Actually, there's a sternum, there is a mastoid, and there is a glenoid bone. So it connects these three places. If you understand the structure, it is very easy for you to remember the name of the muscle. But if you don't understand, because I think so, in our school, mostly like we have trained in a rote memory. We have not trained in associated learning. We have not trained in visual learning. We have not trained in other learning methodologies and things.
right.
So when they
Correct.
get into college, they find it very difficult. That too, when the terms are very difficult, when it's something new, right? It's a little more deeper when you want to study, and each book will be having around 1,000 to 2,000 pages, and you
Mm,
have to looking at the book itself, you'll have a lot of fear factor, and that book alone will not be enough. You have to go and refer in the library. You have to get little more understandings, even though the teacher do lot of work to be done from our end, because till 12th standard it is of lot of support externally, your teacher, your tuition, your institution, there are a lot of things. But once you get into the college, no, you cannot expect that. The only sole responsible person is you for your study. You cannot blame. You cannot tell they didn't teach you. College will not spoon feed you. You have to get ready when you're getting into the college. They put only 20% effort and you have to put 80% effort. In school, it is different. 80% effort from the institution and 20% is from your end. So we have to get our mind ready before entering the college.
so the way
I'm
students
not.
are taught in these schools, that needs to be changed.
Yeah, exactly. The thing is, see, for me, till my 10th standard, my 11th and 12th was a rote memory only, the school where I studied. But till my 10th standard, it is more of understanding. So each and everything, like we never had a workbook. When I studied in a convent, we never had a workbook for even for English. So generally in most of the school, they'll give workbook for English, they give workbook for Tamil, they will give guides and things like that. We never had that system. For our English essay, we have to study the complete chapter and we have to write our own essay. So that made us to think differently and we give our own synopsis and we do and sit our own essay. We give lot of life examples and stories. We were always allowed to write in a different aspects and things. So till my 10th standard education helped me for my college. But if
So
that
when
was not there, because yeah, yeah, I'm saying that there were toppers who came from different institutions. They struggled a lot in college
hmm,
because they scored very good in there, but it was very difficult for them to score in the college because whatever they read, they can write it. But when you get into college, there is no one book. You have
yeah,
multiple books for one subject.
hmm,
So you cannot just read it and vomit it in your book. There
hmm,
is no option possibilities.
hmm.
So for them to understand and create their own answer and put it in the paper, they are finding it difficult.
They have to be more of practical. They have to start summarizing in their own words and understand the different techniques to study rather than
Yeah,
rote learning.
yeah, exactly.
Being able to comprehend and analyze and put it in their own words.
Because we I interact with a lot of students, right? In my
Hmm.
domain, sometimes they will ask some questions and things like that. And they'll say, "Ma'am, this is difficult. That is very difficult." And after I'm talking to them for a few minutes, yes, ma'am, right now it is easy. I will not tell anything. I will just ask them to think in a different perspective. Okay, see here. And I use always because I was an UPC aspirant as well in between. So other than science, I was thinking science was very difficult. Always I had that I've read something, I'm something great kind of thing. I had that attitude. But later, like when I was preparing this, I was about to study history, geography. These are the subjects which was really boring to me during my schooling. Openly to say, like I don't like history because I have to remember a lot of times, dates, and things
Hmm.
like that. So it's a lot of facts and statistics. So I don't like it. But as this exam is lot of demanding on these subjects, so I have to sit and study. Then one day I understood each and every profession has its own difficulties and own pros and cons. So it has both plus and minuses. Each profession is unique, each profession is different. So once for that I do a lot of because it's a different subject, right? So I have to do a
Hmm.
different methodologies and things like that. When as I applied in my life a different methodologies and things, when I give them 1 or 2 points, the way they have to think it differently and why it is important and why you have to have love for the subjects. Very, very important. If you don't love the subject, you will not study.
Right. So unless you fall in love with the
So
subject, you
then
cannot put
there
in
is
your heart over there. Yeah.
yeah, you have to. Do you believe it or not? Every day I will say I love you to my history book when I was preparing for the competitive exam. Because as I'm telling every day, I was really wishing, please, as I'm telling this much I love you, so make sure like you love me back. Actually, it helped me. At some point, I started seeing history in a different perspective. Right now, I love history, openly to say, like during the school I hate history. During competitive also, initially I don't like this subject. It's very difficult for me to understand and grasp it and things like that. Then later, once I created a bond between me and the subject, then it was as you get the bond, the way you think about the subject will be different. Until the bond is created, it is very difficult for you to study the subject.
So, Sandhya, tell me, in this profession, to survive and to grow, to excel, can anyone fit in, or you need some specific skills and personality? Like a person should be a lot of academically good, or maybe more talkative, or maybe more imaginative, or is it something they need to carry on their work in a planned manner, or is it something spontaneous? Like what kind of personality fits in?
See, for studying, there is no personality fit and all the personality will fit in. But when you are to practice, so that is way. See, just think from our perspective. If I am a patient, how you want your doctor or therapist to become? Once we see, that is what always, if we put our legs in the shoes of the other person, you will understand. How will you treat? Example, if your mother or father is going to get treated, you want the best, and when others mother or father is coming, what best you're going to provide for them. So once you think you want to be only best, that is the only thought pattern what I want to put in the student. So you can give the best because you always want the best. So have you ever thought as I want the best, as am I doing my best? Actually,
Right.
there is a song in my language. So it comes like always we question like what this world have done to me, but change the question like what I have done to the world. The perspective change.
So, with the experience you have, Sandhya, and you have been working with the patients online, offline, and
Yeah,
you have been teaching students also, medical students. So, if a
yeah,
student wants to have a career in this field, right,
yeah.
what are your three takeaways for the student who wants to start? And right now they are in either ninth, 10th, 11th, or 12th. So, what's your
Yeah.
advice to them?
My advice to them is it is the best profession as far I know. For each one, their profession is always best. Make sure you go it inside because you love it. Don't go just for the sake like your parents asking you to do, or if you really don't have an option, even though you went inside because of your parents said or your friends joining or your neighbor or whomever said. At least going in, you have to have love towards the profession. That is what will make you best in this profession. And as I always said, for the students, love towards learning that makes you best in any field. So create a love towards learning because always it is going to take you high. It's not going to take you down. Because generally, for students, like learning is a very difficult task because the methodology in the system is wrong. It is not about the learning in itself. So understand if you love it, you're going to do really great in it. So cultivate love towards learning. So that is one advice. And this profession is really booming. So if in case you're interested in healthcare and you want to do something great, always one of the best option if you want to be in medical, get into medicine or something, but you couldn't still getting into this, you will love more than medicine. So that is one strong conviction I can make it here because I know there are a lot of people who have said, even though I have not been so happy, even if I've studied medicine. So I'm not saying that medicine is not great, but if that was an option, but you couldn't get that, this is also a great opportunity. But for me, I feel it is much more greater opportunity than anything else, because you're going to serve a person without medications, without surgery, without any side effects, and still you're going to get them all right, be independent, and do their things on their own. And the blessing what you're going to receive it from the service what you're providing is really, really huge. And the fulfillment and satisfaction in this job is really high. You cannot get, even if you get 1 CR money in return for the satisfaction and fulfillment in this profession. So go for it. Yeah. So these are the three things I want to tell. So
So you
cultivating,
become
yeah,
cultivating the passion and then continuous learning and then serving the people, getting
yeah,
that
serving the people,
satisfaction, their blessings.
yeah, serving the people, and go because you love it. Do some research, because once you do research, you will love to do this particular profession. Uh, that should be your first thing. You have to choose this profession. But in case it is chosen by someone else and you're doing, but make sure you're cultivating love for this profession.
Right. So you become a doctor without giving medicines and you cure
Yeah,
the patient as well.
yeah. Without medicine, without surgery, and without side effects. To
That's a
point out.
blessing. Yeah. Thank you.
Yeah,
Thank you so
that's
much,
it.
Sandhya. If any student or parent wants to connect with you, like how
Yeah.
can they connect with you?
Yeah, I'm there in LinkedIn, I'm there in Insta, and also my website is telephysio.in, where my contact details are available there too.
Do you help students in help in the internships or job shadowing as well if they want to come and see what it is?
I train physiotherapists, majorly the students in internship and PG, and also the people who have completed physiotherapy on telephysio, and also non-clinical skills. I teach for physiotherapists, majorly for physiotherapists who are in physiotherapy profession. I teach them non-clinical skills like finance, leadership training, mindset, and personality development, and telephysio, entrepreneurship. So these are the areas I train people who are already into the profession.
Right. So if anyone wants to get into the learning of these areas, they can connect with you. And as you shared, all the
Yeah,
links and your websites and details I'll share in the description of the YouTube video.
yeah, sure.
Thank you, Sandhya, for coming
Yeah.
on this show and sharing your career journey with the students and also
Yeah.
giving deep insights into what is physiotherapy.